If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Acute sinusitis. Sinusitis means your sinuses are inflamed. The cause can be an infection or another problem. Your sinuses are hollow air spaces within the bones surrounding the nose. They produce mucus, which drains into the nose. If your nose is swollen, this can block the sinuses and cause pain. Acute sinusitis often starts as a cold, which then turns into a bacterial infection. Allergies, nasal problems, and certain diseases can also cause acute and chronic sinusitis. Symptoms of sinusitis can include fever, weakness, fatigue, cough, and congestion. There may also be mucus drainage in the back of the throat, called postnasal drip. There are several types of sinusitis, including acute, which lasts up to 4 weeks. Subacute, which lasts 4 to 12 weeks. Chronic, which lasts more than 12 weeks and can continue for months or even years. Recurrent, with several attacks within a year. Your healthcare professional diagnoses sinusitis based on your symptoms and an examination of your nose and face. You may also need imaging tests. Treatments include antibiotics, decongestants, and pain relievers. Using heat pads on the inflamed area, saline nasal sprays, and vaporizers can also help. What are the causes of sinusitis? The sinuses are air-filled spaces in the skull. They are located behind the forehead, nasal bones, cheeks, and eyes. Healthy sinuses contain no bacteria or other germs. Most of the time, mucus is able to drain out and air is able to flow through the sinuses. When the sinus openings become blocked or too much mucus builds up, bacteria and other germs can grow more easily. Sinusitis can occur from one of these conditions. Small hairs called cilia in the sinuses fail to properly move mucus out. This may be due to some medical conditions. Colds and allergies may cause too much mucus to be made or block the opening of the sinuses. And a deviated nasal septum, nasal bone spur, or nasal polyps may block the opening of the sinuses. The following may increase the risk that an adult or child will develop sinusitis. Allergic rhinitis or hay fever. Cystic fibrosis. Going to daycare. Diseases that prevent the cilia from working properly. Changes in altitude such as from flying or scuba diving. Large adenoids. Smoking. Weakened immune system from HIV or chemotherapy. And abnormal sinus structures. What are some of the major identifying symptoms? The symptoms of acute sinusitis in adults very often follow a cold that does not get better or that gets worse after 7 to 10 days. Symptoms include bad breath or loss of smell. Cough, often worse at night. Fatigue and general feeling of being ill. Fever. Headache. Pressure-like pain, pain behind the eyes, toothache or tenderness of the face. Nasal stuffiness and discharge. And sore throat and postnasal drip. Symptoms of chronic sinusitis are the same as those of acute sinusitis. However, the symptoms tend to be milder and last longer than 12 weeks. Symptoms of sinusitis in children include cold or respiratory illness that has been getting better and then begins to get worse. High fever along with a darkened nasal discharge that lasts for at least 3 days. And nasal discharge, with or without a cough, that has been present for more than 10 days and is not improving. Exams and tests. The healthcare provider will examine you or your child for sinusitis by looking in the nose for signs of polyps, shining a light against the sinus, transillumination, for signs of inflammation, and tapping over a sinus area to find infection. The provider may view the sinuses through a fiber optic scope, called nasal endoscopy or rhinoscopy, to diagnose sinusitis. This is often done by doctors who specialize in ear, nose, and throat problems, called ENTs. Imaging tests that may be used to decide on treatment are a CT scan of the sinuses to help diagnose sinusitis or view the bones and tissues of the sinuses more closely. and an MRI of the sinuses if there might be a tumor or fungal infection. Most of the time, regular X-rays of the sinuses do not diagnose sinusitis well. If you or your child has sinusitis that does not go away or keeps returning, other tests may include allergy testing, blood tests for HIV or other tests for poor immune function, ciliary function test, nasal culture, nasal cytology, and sweat chloride tests for cystic fibrosis. What are some self-care treatment options? Try the following steps to reduce stuffiness in your sinuses. Apply a warm, moist washcloth to your face several times a day. Drink plenty of fluids to thin the mucus. Inhale steam 2 to 4 times per day. For example, while sitting in the bathroom with the shower running. Spray with nasal saline several times per day. Use a humidifier. And use a neti pot or saline squeeze bottle to flush the sinuses. Be careful with use of over-the-counter spray nasal decongestants such as oxymetazoline named Afrin or neosynephrine. They may help at first, but using them for more than 3 to 5 days can make nasal stuffiness worse and lead to dependence. To help ease sinus pain or pressure. Avoid flying when you are congested. Avoid temperature extremes, sudden changes in temperature, and bending forward with your head down. And try acetaminophen or ibuprofen. Medicine and other treatments. Most of the time, antibiotics are not needed for acute sinusitis. Most of these infections go away on their own. Even when antibiotics do help, they may only slightly reduce the time it takes for the infection to go away. Antibiotics are more likely to be prescribed sooner for children with nasal discharge, possibly with a cough that is not getting better after 2 to 3 weeks. Fever higher than 102.2 degrees Fahrenheit. Headache or pain in the face. And severe swelling around the eyes. Acute sinusitis should be treated for 10 to 14 days. Chronic sinusitis should be treated for 3 to 4 weeks. At some point, your provider will consider other prescription medicines, more testing, and referral to an ear, nose, and throat or allergy specialist. Other treatments for sinusitis include allergy shots, called immunotherapy, to help prevent the disease from returning. Avoiding allergy triggers. Nasal corticosteroid sprays and antihistamines to decrease swelling, especially if there are nasal polyps or allergies. And oral corticosteroids. Surgery to enlarge the sinus opening and drain the sinuses may also be needed. You may consider this procedure if your symptoms do not go away after 3 months of treatment, and you have more than 2 or 3 episodes of acute sinusitis each year. Most fungal sinus infections need surgery. Surgery to repair a deviated septum or nasal polyps may prevent the condition from returning. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.